Hello everyone. Have you ever heard of bubble boy disease or severe combined immunodeficiency or SCID? Welcome to your own channel ADP for learning. Today we will dig deep into severe combined immunodeficiency or SCID by addressing some key questions like what is severe combined immunodeficiency, SCID? Which gene is affected in severe combined immunodeficiency, SCID? What are the symptoms and features of severe combined immunodeficiency, SCID? And at last, how to treat or manage severe combined immunodeficiency, SCID? So without further delay, let's start with what is severe combined immunodeficiency, SCID. Severe combined immunodeficiency is a group of very rare, and potentially fatal, inherited disorders of the immune system. The immune system normally fights off attacks from bacteria and viruses. People with severe combined immunodeficiency have a problem in their immune system that leaves them open to infections. According to the Centers for Disease Control and Prevention, or CDC, about 1 in 58,000 babies is born with severe combined immunodeficiency, SCID, in the United States each year. The CDC also notes that SCID is more common in males and in certain ethnic groups, such as Native Americans and Arabs. Severe combined immunodeficiency is sometimes called bubble boy disease. In the 1970s, a boy named David Vetter lived in a plastic bubble for 12 years because of SCID. So that leads to another important question. Which gene is most affected in severe combined immunodeficiency? There are several types of severe combined immunodeficiency, and each is influenced by a different gene. One type, caused by a deficiency of adenosine deaminase described in our previous video. The most common form of severe combined immunodeficiency is SCIDX1. The affected gene in SCIDX1 is IL-2RG, which is interleukin-2 receptor gamma, on the X chromosome. This gene codes for one of the proteins that make up the IL-2 receptor. People who have SCIDX1 have a non-working copy of the gene, and so their IL-2 receptor does not work. The IL-2 receptor is active in immune cells, where it helps them communicate with one another when they find bacteria or viruses. When IL-2 is activated, the body makes more immune cells so that it can fight off infection. With no working IL-2, too few immune cells are made, and the body is left defenseless. SCIDX1 follows an X-linked recessive inheritance pattern. The disorder almost exclusively affects boys, who inherit the disease-causing gene variation from their mothers. As shown in the figure, SCIDX1 is caused by a problem with a gene on the X chromosome. Since boys have just one X chromosome, having one non-working copy of the gene causes them to have severe combined immunodeficiency. So that raises another important question. What are the symptoms and features of severe combined immunodeficiency? Symptoms usually appear in the first few months of life. Because they have very little immune defense, babies with SCID tend to get one infection after another. They may have a lot of ear infections, sinus infections, a cough that does not go away, and rashes on the skin. Some infections may be life-threatening, including pneumonia that is lung infection, meningitis that is brain infection, and sepsis that is blood infection. People with severe combined immunodeficiency often don't respond well to antibiotics, making bacterial infections challenging to treat. With no intervention, children with severe combined immunodeficiency rarely live beyond age 2. At last, the question may arise, how can we treat or manage severe combined immunodeficiency? Children with severe combined immunodeficiency must be careful to stay away from germ-rich environments, where they could pick up a life-threatening infection. Most babies who may have severe combined immunodeficiency are placed into a sterile environment immediately after birth so that they will not pick up an infection. Antibiotics, antiviral drugs, and antibodies from the blood of healthy donors can also prevent infection. One treatment, and potential cure, for severe combined immunodeficiency is a bone marrow transplant. Bone marrow contains stem cells that give rise to blood cells, including immune cells. Bone marrow stem cells from a healthy donor are injected into the person with severe combined immunodeficiency. The transplanted stem cells can then give the person with severe combined immunodeficiency a working immune system. The biggest challenge to this treatment is finding a donor who is a good genetic match for the recipient. Siblings are usually the best donors, as their cells tend to have a more similar genetic makeup. But if parents have one child with severe combined immunodeficiency, and they have another boy, he will have a 50% chance of also having the condition. Girls will be unaffected, but they may be carriers. Another way to cure severe combined immunodeficiency is through gene therapy. Gene therapy places a working copy of the IL-2RG gene into the patient's own bone marrow stem cells, and then returns the cells to their body. Gene therapy is relatively new, and there are some technical challenges to getting it to work, but it has been used successfully to treat multiple forms of severe combined immunodeficiency. It is likely to become less costly and more available over time. Thank you for joining me on this fantastic journey of learning. We will again meet with new innovative topics. Meanwhile, if you have any doubts or feedback, please comment below.